our life is a roller coaster, basically. It goes up and down. When the roller coaster goes up, we don't think that it will go down, but it will go down. And when it goes down, and that's the problem, we just look for it will never will go up. But that doesn't happen. Life is something like that. It will go down and go up. To go up, always we get kind of sometimes excited, sometimes we get fear, like because it's too high. But when it goes down, then we think why it's not high enough. So today I'm going to actually introduce you few experts in our community who can help us to guide how we can deal when we are on the down in the roller coaster. So let me start first introducing our panel. Okay, so I'm going to start from my left side. Dr. Jaria Chaudhary, and she is the attending in the Brookwood Hospital, and she has a private practice also, and Pelham and Gadsden with the Alabama psychiatrist. She is a graduate from the UAB, and she's been in our community for almost 11 years. Yes, so she is actually did her residency in UAB also. Next, I'm going to go Brother Ahmed Al-Hassan, and he is actually very experienced. You did the psychiatrist for a long time, and you're the faculty in Sudan, and then now doing the residency in the UAB also. Thank you so much for coming. So Dr. Ehtasam is not here today with us, but he is actually will join with us, inshallah, sometimes next month. And he is, actually he works in the RCCA clinic in BIS also, and he is, I think he's a medical director in the telemedicine in the VA, and also works in the UAB. Then we have Dr. Zahid Hussain, and he is actually did the residency in UAB too in the psychiatrist. I think, Brother Zahid, you've been with us for 15 years? Yeah? Yeah. Oh. Yeah. Uh-huh. 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 I see. Alhamdulillah. Thank you so much for helping us. Mm-hmm. Okay, then I'll go, I didn't introduce myself, so let me introduce myself. I'm a physician in the UAB. I'm with UAB for 18 years almost. I'm working as a medical director in the geriatric clinic, also do the consultant in the VA. And Sister Yasmin Nimar is the counselor in the Aya. She did the bachelor in the psychology here, and she has so many things have done. Everyone knows her, so I don't want to say anything and then underestimate her. She's great. And then next we have Sister Sherin Jover, and she is with us. I think you moved in the COVID time from Florida, correct? From Texas. And she is actually OBGYN from India, and here did the certification on the life coach, and she's helping us with the life coach. And then, of course, I don't have to introduce Brother Tariq, right? Everyone knows him, and Bashar also is helping us in this project also. So next one, we will go, next slide will give us some idea who is our youth leader, future leaders. They will be our future. Aska, would you introduce just quickly to everyone?
Assalamu alaikum everyone, my name is Aska Izada. I'm a fourth year student at UAB majoring in public health, and I am the president of the Muslim Students Association, and I am also a mental health ambassador. So mental health in the youth is something that's very important to me, especially in regards to our faith and inshallah, I'm really excited.
Mm-hmm. And Maggie.
Hello guys, my name is Maggie Khan. I'm currently a senior at UAB and I'm majoring in biomedical sciences, and I hope to be a good resource for anyone who's struggling with mental health and also make it easier to talk to your patients as well.
Thank you so much. So I'm going to hand it to Dr. Zaria now.
Thank you so much. Okay. Thank you so much. Thank you so much, Dr. Saminauddin. Hope everyone can hear me from the back. Do you hear me? Assalamu alaikum wa rahmatullahi wa barakatuhu. Thank you so much. I want to start this session by saying my heartiest thanks to all BIS leaders, especially Dr. Saminauddin, Dr. Nasimuddin, Brother Tariq, and you all for taking this wonderful initiative and very noble initiative. I would say this initiative is a path breaking, especially to talk about mental health, which has been a huge stigma globally for years. And even with pandemic, with such crisis of mental health crisis as a psychiatrist we are seeing daily, I would say this is something, that issue is a must to talk about. Because especially in pandemic, that one thing I tell my patients, and in our community too, if we are alive, we are thankful to Allah to be alive today, right? We are here, we can talk about it. But more or less, if one thing is somehow affected, you know what? It's mental health. So it's a huge issue to talk about. So I thank you again for creating this platform and inviting us, the psychiatrist panel and mental health experts in the Birmingham Muslim community, practicing in Birmingham area over last several years to address this one of the most important area of our life, which is mental health. Dr. Saminauddin already introduced myself. I'm Dr. Jaria Afrin Chaudhary. I've been practicing as an attending psychiatrist at Brookwood Hospital, and my practice group is Alabama Psychiatry, where I see a huge volume of mental health patients actually in my outpatient setting, and I provide telemedicine service for this population since almost last 4 years. Before that, I did my residency from UAB. So welcome everyone, and I thank you all for joining, and this is such a spirit, and hopefully in future, more people will be here, inshallah, to listen to us so that we can spread this mental health awareness throughout our community and help the people who actually need the right help on right time from the right person in the right way. So it's a blessing. I'm humbly blessed to be able to have this opportunity to talk about these issues. And may Allah help us all to be able to recognize what is mental health issue actually? What are the disorders? When we call crisis, when we call disorder, so why we call it? So that's the thing. So let's first start talking about what we mean by a sound health, right? So brothers and sisters, when we talk about health, we are often neglect one thing. We always focus on our physical health. Say we have diabetes. We always check our blood sugar. So the simple remedy, diet, drug, discipline that we say, right? So what happens when mental health is affected? It goes to at that point when there is really hard to treat. At that point, people come to us for help. So here is how I explain my patients. No, the prior slide, please. Thank you, dear. Yeah, so here is how I explain my patients that we need to take care of 4 domains of health and our well-being to stay healthy and feel healthy, and all 4 those things actually construct our health. So we need to take care of our physical well-being. We need to take care of our mental health, mental well-being. We need to take care of our emotional well-being through our prayers, meditations, and self-care. And we need to take care of our spiritual well-being. So how beautifully our religion also says it, all right? So we often overlook these things, but actually these four things construct health. And we can be healthy only if we can take care of all these four domains nicely. So next thing for which I'm here, and we all are here, actually, the panelists here, to talk about the stigma. So over the years, mental health is something, is not only our community, because as I see, like USA is such a progressive, such a developed country, right? But still it is something, it's improved. Definitely in last few years, people are now talking about it and it's definitely improved, but still it's a huge stigma. So we are here to break the taboo. We are here to tell you, ask help at the right time, before it's too late, from the right person, from the health professionals, from the psychiatrists who will guide you what's going on and what help, what type of treatment you need. Do you need a therapy referral? Do you need medicine? Or how far? What is the, like, your model of treatment, what it should be the treatment plan, and in the right way. So let's talk about mental health, and I'm so encouraged to see today some of our young generation, because it's the exam week. I think more will be here next time, inshallah. So we'll be more than happy to answer any question any community member have in our short time, but we'll do the best we can to address those most important issues that we face daily, see daily, and alhamdulillah treating daily successfully. So the next slide, I'm gonna just show you, like we all love to see data, what the data says. So here is the thing. The mental health issues are increasing in USA and globally. It's a worldwide crisis, right? Like in the pandemic, we call that there is after pandemic, there is certainly another hidden pandemic going on, which is actually mental health pandemic. We just don't know. The numbers even here reflect some, but you will be surprised when I show you the next data. Here, it's already showing that very few percentage of people actually feel hopeful most of the time. Hope is a huge thing, right? That makes a huge difference in our life. We can do anything as long as we have our hope up. So here is the thing, and can you please go to the next slide, dear? Yeah. So this is an interesting slide, and the mental health that affects globally how see the age group, gender, and ethnicity-wise. So here you can see, if we can see gender-wise, what percentage of female actually in the USA are suffering from mental health? Almost 25%. So 1 in 4 women actually suffering from some type of mental health disorders. So it's a big number than anything else, right? If you talk about all our other ailments of health, so it's a big deal. And even male is 16.3%. And then we talk about age, that we all know that which age group, unfortunately, is most affected is our young generation, because they can share. The more important thing, sharing is caring, and share with the right person who will actually guide you through the right way. That's why I really appreciate our brothers, our community leaders here, who actually approached us that, sister, show us the right way. What are the red flags that actually we can refer those people to you who need actual help. So here is the thing, because our youth, some of them want to talk about, some of them, they can share their feelings with their parents or their families, what's going on in their mind. So it's a big percentage actually is showing that they are suffering from, So 29.4, so basically more than 1 in 4 basically suffering from that. And ethnicity-wise, you know that white people suffered the most, and black little less, Hispanic little less. The good news is Asian people suffer a little less, but still, I don't know where it is the value or so, but again, do you hear me from the back? Is good? Okay. Exactly. Exactly. There are a lot of confounding factors here. Data are like, like driven, but definitely there are a lot of factors there. That is a huge issue to talk about. It will take me another day actually. So here, since, our goal today is just to address like very, very basic points so that we can at least recognize some simple issues, and then we can refer the right help to the right people, and we can do the right referral. That's the thing. So Elma, next slide, dear, inshallah. Okay, so I'm not going to take much time because it will take me like a day if I talk about all these disorders that I see daily, treat daily, right? So, but these are, like, I picked one of the most common mental health disorders that we see daily. And to your surprise, you will be surprised, like data-wise also, the most important thing, I'm sorry, is it covered? No? Oh Lord, sorry. You should have told me. I'm sorry about that. So, yeah, so do you hear me? Sorry, I'm on call in the hospital today for Brookwood as well. So I'm holding the phone in one hand. I'm holding this in one hand. I wish Allah give us two hands. So, yeah. My kids are here too, listening to their mom today. Okay, so the most important thing is the anxiety, and most common thing is also anxiety. Huge percent. If we see the percentage of mental health disorders, the most common one that we see is actually anxiety disorders. So, which is generalized anxiety disorder is the number one thing, then social anxiety disorders, panic disorders, and phobia. So here is my very simple way of explaining my patients that I do daily is what is anxiety when we call it a disorder, right? So when it is an anxiety disorder, at that point, like people will tell me, Dr. Chaudhary, I'm a lifelong worrier. I just excessively and disproportionately worry about things that's not in my control. I'm all the time anxious, always edgy, always on the go. I'm always restless. I cannot sleep. I can't focus on my task. So this type of restlessness, when you have like all the time palpitation, some people have like a panic attacks. So when this type of crippling and dysfunctional type disabling anxiety affects you on a daily basis, and it lasts for about 6 months, then we call it generalized anxiety disorder. Very common. Very, very common, but very treatable as well. So we have a lot of ways to treat anxiety with medication. There is certainly some chemical imbalance when it goes to the point of disorder. There are medication, there are all different types of very good therapy. We refer them to see our therapist in the clinic. So there are a lot of different ways to treat anxiety. Then social anxiety. The youth, the young population actually tell me this. Social anxiety is such a thing that starts from childhood. Some kids, you will see that they have performance-related anxiety. When they want to give a talk, they have anxiety. They have anxiety speaking in public. They have anxiety socializing in a public gathering. So they avoid. Some people have even anxiety coming to the social gathering like a mosque in a big setting because they have panic attacks seeing people around. So that is we call social anxiety disorder. Panic disorder, another term, like panic attacks I just explained, and phobia is another term, very common. There are so many different types of phobia. So OCD and OCD spectrum, my colleague, Dr. Hassan, he's gonna explain this, so I'm not gonna elaborate that one. So now another most important and crucial thing that I know Dr. Hussain and Dr. Ehtesham Haq will elaborate on the trauma thing, but this is a big picture of what we treat. So under the umbrella of trauma and stressor-related disorder, there is acute stress disorder, PTSD. So after pandemic, if we know one mental health term, I think everyone knows PTSD, post-traumatic stress disorder. So when something like very, when we see crisis, when we see death, when we see our near ones suffer, when we suffer, so that type of very severe trauma, if that type of trauma actually affects us the way that it is a persistent problem, Like we all go through crisis and we all have our own set of coping skill, and eventually we get over with the grief, with the trauma, as Allah knows, Allah shows us the way. Allah gives people the way they can handle, there is a saying. But still we all have our own personality, own set of coping mechanism. But some people, unfortunately, despite all this, they cannot cope. And it goes to the point when they have nightmares, when they have flashbacks, especially brothers and sisters after this pandemic. You will be surprised which people are the most affected ones. And you probably know, the healthcare professionals in general, because they have seen so much. The ICU nurses, the teachers, the police officers, like who have seen things so much. It's so hard to bear. So those people now coming to us, they cannot cope with it anymore. Now even today they are suffering, and when this suffering is more than a month, we call it PTSD, post-traumatic stress disorder. But with medication, therapy, and everything which we can prevent, then when it is resolved within a month, we call it acute stress disorder. Okay? Like it's very hard to explain all these things in my short, talk, but I'm just giving you a brief outline today, so that at least if you can get the gist out of it from today's talk, you can, who knows, you can help someone. So there are some other terms here, like adjustment disorder is a huge issue. Lot of things in marriage, lot of things happen in life. Youth, like when they are growing up, especially our adolescents, they go through a lot of adjustment crisis. So when it gets to that point, there is a term called adjustment disorder as well. And prolonged grief disorder, reactive attachment, I will bring that issue on my next session, inshallah. Yeah. So my last slide, I will not make you bored. So it is the most crucial thing. We all want to talk about it, but we don't talk about it, and that is depression. So depression, a day or two sadness here and there, no, that is not depression. So what is depression? We need to know the right way, so that at least we know the red flag signs. We don't need to be a psychiatrist. Also, we don't need to overdiagnose ourselves. If we feel that way, we just get the help. That's what it is. So when I call like a major depressive disorder or clinical depression, so what happens is, so this is how I explain my patients when I see patients, okay? If this is my normal happy medium of my mood, so in depression, people go downhill. For a couple of weeks, they will tell me, Dr. Chaudhary, I'm extremely sad or depressed for no reason for 2 weeks almost. When I'm extremely sad, I'm losing interest in things in life that I used to enjoy in the past. This is we call anhedonia. Very important two things I mentioned, depressed mood and loss of interest in things, normal things in life. Besides that, people can have feeling of hopelessness, worthlessness. Some people sleep a lot, some people don't sleep. Insomnia or hypersomnia, we call. Some people eat a lot, some people don't eat. Some people lost weight, some people gain weight out of depression. Then they lost motivation in life. They have no energy. They don't want to get up and go and get their things done in life. When it goes to the rock bottom, people can even start feeling like passively or actively suicidal. This is the last and most important thing that I want to mention before I finish my talk, that when depression goes to this point, it doesn't go to this point initially, but if it goes to the rock bottom, people start feeling like life is not worth living anymore or suicidal. So these are like a very big picture, and if it lasts for about 2 weeks, we call it major depressive disorder. There is another term called persistent depressive disorder. These people have a persistent low-lying mood. They never touch a happy medium. These people all the time little sad, little gloomy, all the time. They don't find very pessimistic. They don't find the joy in life that normal person should do. So when they come to us, like, Dr. Chaudhary, I have always been like this, but last 2 years I've been always down. And their depression sometimes goes even downhill, which is the major depressive disorder. So it's a big term, a lot of things to explain. But overall, if we know the red flag signs, when someone is so depressed that is affecting their day-to-day life, their functionality, to the point that they need help, they need to seek help from a psychiatrist, from the mental health experts, through proper medication, proper counseling, therapy, self-care, prayers, meditation, mindfulness. There are a lot of things. All together, definitely there is hope, and so many people get better and live completely functional life, trust me. Success rate is very good. Yes, you need to know the right way from the right person to seek the right help. I'm telling again, let's break the stigma. Bipolar disorder is a big topic. I don't know how much time I took already. If you have patience to hear about bipolar today, or I will save it for the next time. Yeah, so brothers and sisters, thank you so much for your patience and time, for listening to us today. Hopefully somewhere, somehow we can help someone with the crisis and they get the right help. So I will invite my colleague Dr. Hassan to talk about some few more important topics, and finally we'll share the resources that we have in the community where to get help, and we will share that in our website too, inshallah. Allah Hafiz. Thank you so much. Jazakallah khair.
Assalamu alaikum everyone. Can you hear me well? Let me just make sure that it's in place. Okay, so my name is Ahmed Abdul Karim Yusuf Al Hassan. I'm from Sudan. I'm new to the community. I just came back in June, but I worked like for 7 to 8 years in Qatar. I did my residency and fellowship there. I came to the US 2 years ago, or year and a half. I did like 1 year fellowship in psychosomatic medicine at Mayo Clinic, Rochester. And because I decided to, stay in the States for a while, I need to start over my residency, so that's what I'm doing here at UAB. Thank you, Dr. Samina, for the introduction. Thank you, Dr. Sheikh Tariq, for gathering us all around. May Allah, inshallah, we all gather in Jannah, inshallah. Inshallah. So, those are my, So those are my objective of my talk. So basically there's a lot of like misconceptions and myths. Oh, okay, let me see. Yeah, I think that's correct, yeah. So there's a lot of misconceptions and myths about mental illness that, like being in Qatar, there's a lot of things that I heard from patients, and I'm sure that, a lot of people have those, false ideas of mental health or mental illness in general, so I will try to go through those. I will briefly talk about, schizophrenia, OCD, and addiction in general, and aiming to correct any misconception on those things. And I will share my ideas, like as a group or community, how we can help BIS as mental health professionals. And also I will share some online resources and some resources in the community where you can reach or find like mental health help. Okay, let's see. So the first thing that I want to emphasize on that mental illness is not related to evil eye or witchcraft. Yes, like al-mas or sihr or jinn, it's there in our religion, but it's not always the case. Most of the patients I see in Qatar, they go to 10 or 15 religious healers before coming to seek mental health problems. So what I always tell the patient that it's okay to do ruqya shar'iyya, but at the same time it's very important to see like mental health professionals. Another thing that, mental health or people with mental disorder, they think that, they don't have enough iman or something like that. So that's not true. Like you can see sheikh or imma coming to the clinic have depression and anxiety. This is something that can happen to everyone. So spirituality can help preventing or protecting you from having mental health problem, but it's not necessarily like, you will be totally immune to mental health problem because you have enough iman and being spiritual. So that's something you need to keep in mind. What's the next one? Yeah. So a lot of people who have mental illnesses, like from different spectrum, depression, anxiety, schizophrenia, they might be walking among us and we don't even know them. They have like an active lifestyle, they have jobs, they have, it's being diagnosed with mental illness, it doesn't mean like you'll be abandoned in the community or in your family or not be able to do anything. with the right treatment and right medication, you can be just functioning normally. And it varies. Like there's some people have a severe mental illness that actually like, make him some sort of like disabled or incompetent, but on the other hand, there's a lot of people who actually can live almost a normal life with mental illness. The other thing that always, like, I always hear this in the clinic, like, if I take psychiatric medication, I will be addicted to it. Actually, most of the psychiatric medication, they don't cause addiction. You can take them fine, and it won't make you crazier or be like, more ill. Most of them are safe. Yes, there's side effects, and this is the case for any medication that we are taking, but taking those medications doesn't mean that, you'll be addicted to it. And the last thing that I want to emphasize on this slide, that psychotherapy can help. You will not just go there, lie on the couch and talk to a random person about your life and you'll feel better. It's something structured. It's something that people who study psychology, like they spend years, know how to help patients with different mental disorders using psychotherapy. And sometimes in some situations it can help even more than medications. So this is something that I emphasize as well to really consider. All right. So yeah, I think that's an important topic. I thought a lot about before sharing this with you or not, but I'll try to make it very simple. So here in the state, we have something called the Diagnostic and Statistical Manual of Mental Disorders. This is like the reference for us to diagnose any mental health problems. Like Dr. Chowdhury talked about depression, there's certain, description about depression there. So basically, each mental disorder in this book, like it talks about a group of signs and symptoms that happen in a certain duration and it will lead to impairment of function. So just remember these two words, impairment of functioning. Like when the symptoms actually affect your daily functioning, then this is the problem. This is when you actually need sometimes medication or need to see a therapist. Like in and out, depression, sadness, and anxiety that can happen as a human. We feel anxious, we feel depressed from time to time, and this is normal from us. But when you actually cannot do things or your daily function is impaired, this is when we actually need to intervene as a mental health professionals. So yeah, a lot of changes has been happening. If you can see, it's getting bigger from the DSM-2 until DSM-5. So they are describing a lot of mental health disorders. One thing also to emphasize on that, there is no blood test, there is no X-ray, there is no imaging can diagnose mental health problem. It's something can happen like for a different reason that still we don't know yet about it. So I consider this book is more of a language that we use as the healthcare professionals to talk to each other to understand what's going on rather than actual something definite that we can rely on. And other thing that people also might one of the rabbit holes that people might fall in, like, for example, the doctors told me, like, I have OCD, for example. You open this book, there's, like, for example, like 7 or 6 symptoms of OCD. I have 3, that means I will have the other 4 or 5. So it doesn't go this way. I always tell the patient, just focus on your problem. If you have the symptoms, let's work on them. Doesn't mean that you will have the other symptoms or the other signs. So yeah, that's one thing that also I wanted to emphasize on. All right, let's see. So I'm sure that you heard this term a lot in movies. So one thing I want to, that people misunderstand with schizophrenia is it's not multiple personalities. It's not. A better description for it is more of a detachment from reality. Okay. In Arabic it's called فصام أو ممكن نقول عنه فصام عن الواقع. And there is 2 major symptoms or signs, delusions and hallucinations. There's other symptoms, but I think those are the main ones. So delusions, the definition of delusions are fixed, false, unshakable beliefs. For example, someone will believe that, for example, like aliens are coming and they will, for example, kill him, or the CIA are coming against him or something like that. This is the common delusion that we hear from people in the clinic or in the hospital mainly. And it's just something that does not make sense, and they actually believe in it because, subhanallah, whatever happening in the brain makes them believe in this way. And hallucinations are just like people will be seeing things, for example, or hearing things no one else can hear or see. So their brain makes them hear things or see things that they don't want, that no one else can hear. So those are the main two symptoms of schizophrenia, and usually it starts slowly, like patients will be like withdrawn, isolating themselves, act weirdly. Sometimes they don't take care of themselves, they don't shower or bath before they actually express those symptoms. Those two symptoms does not happen only in schizophrenia. People sometimes they take drugs, for example, they will become psychotic. They will have those two symptoms sometimes. Yeah. So I'll talk a bit about that in the addiction part. Okay. So obsessive compulsive disorder. It's two parts from the from the name itself. So obsessions are recurrent, intrusive thoughts, urges, or images. And the compulsions are the repetitive rituals. What do I mean by that? Let me give you a simple example. A patient will have an obsession, this obsession that, for example, there is germs everywhere. The germs will get me or I will be killed by germs. So, and he have these thoughts just over and over. He knows that this thought is not correct or not right, but he can't, keep it away. It just keep coming for him. So this is an obsession. And this makes them very anxious. And some patients, not all of them, they will react to this obsession by a compulsion. So the repetitive ritual will be, for example, washing their hand. And it's not just washing their hand 1 or 2 times. It will be, for example, 9 times, 12 times, in a certain pattern, in a certain order. If they miss this order, they will repeat washing again. And it will take them hours every day to do that. So this is one example of how OCD will present, and usually patients will have those symptoms for at least 6 months. So addiction in general can be, for substances like alcohol or drugs, and can be to other things like habits. For example, there is also something mentioned in the DSM about video games addiction. There's like pornography addiction. There's a lot of things that you can be addicted to it. But basically, this picture just simply explains what happened in the brain. Like you take the substance, you will have a chemical called dopamine. It will just gush in your brain and you'll feel great about it. And then it will be a vicious cycle. You'll always seek more dopamine to feel great, to have this feeling that the substance or whatever you are addicted to will lead to that. So a lot of people heard about like cannabis being legal, like in the States, or weed. A lot of studies, say that if you take cannabis, especially if you are younger, there is 2 to 3 times higher risk of schizophrenia, the disease that I just explained. So we need to be very careful, especially in young generation. So your brain will be developing, and when you take drugs at this age, things might go in the wrong direction. All right, so next will be, I think, so this is briefly what I have. So as Dr. Chowdhury mentioned, it's just like some few things just to stimulate our brains, to open the discussion, to invite questions about mental health problems that we just discussed. There's a lot of things that we can talk about, but it's just an introduction. What we thinking about doing, and we discussed that in one of the meetings, as the way we are maybe can help by spreading the awareness. For example, through emails or WhatsApp groups, we can like send a small tip or information about mental health. We can do those talks as well on a regular basis. Every month we can talk about mental health problem, a certain topic. For example, like khatira every now and then about something like that. We can also help with that. This is one thing that we are planning to do. The other thing that we are planning to do as well is, if someone is interested, especially the mental health, the community leaders, we can help training mental health advocates. So people in the community, we can sit with them for maybe 3 or 4 hours, like as a workshop, tell them about mental health problem and how they can identify. Like, we don't expect them it's just to know the warning sign or the red flag that makes him, this guy has a problem, he needs to see a psychiatrist or a therapist, something like that. So this is something also we are planning to do. It's no date determined yet about this workshop, but I hope that we'll be able to get this done. Well, I think it will. Yeah, I think it will take longer than this. Like, I don't think someone wants to stay for khutbah for 1 hour or two, or rather than 3 or 4 hours. So yeah, yeah, yeah. I think that, yeah, I think spreading awareness and emphasizing that mental health is a problem that you need to seek help for. Yes, it can be mentioned in khutbah, just like as a general idea. But the idea of this workshop that for people, especially the community leaders, I think Sheikh Tariq once told me that a lot of people reach out to him thinking that they have like mess or sihr or something like that, but they actually have mental health problems. So I think having people who in the community, like our president or other people who are interested, I think because people actually reach out to them, ask him about what's going on with us, we don't know what's going on, and we don't know any resources that we can reach to mental health problems. So I think training them or training any other one who's interested, I think they will be helpful as well. One thing I want to share with you, like a lot of people assume that because they are in a Western country, that because they are Muslim, they are protected for mental health problems. So that's not true. Actually, those institutes that I'm listing here, they are, based here in the States, and they are run by Muslim people, and they are all Muslim mental health professionals, and they are willing to reach out to Muslim community to help them. So, I got some resources. Brother Bashar, Jazakallah khair, helped me also to get other resources here. So you can just log in, go to their website, or if you can Google those names, you can see a lot of information if you want to see a therapist or psychiatrist, and they are all across the US, and it's all run by Muslim mental health professional.
So we're going to post them in the website.
Yeah, yeah, and yeah, this is another one I forgot as well. Yeah, so this is Dr. Samini shared that with me. Those are like resources here in the community in Birmingham. Like, I think this is all just mental health resources, not for Muslim specific, but it's just mental health resources. So those are also, I think they will be also posted in the website as well. So it's good to be aware that there's a place to go here if you want to see someone in person. And I think, yeah, this is also all other resources that it will be posted in the website. And I think this is us again. Yeah. So I'm currently doing residency, so I still don't have a clinic. I need to finish my training for 3 or 4 years, then I'll be able to work independently. But I'm doing residency at UAB as well. And so Dr. Chowdhury, Dr. Haq, Dr. Zahid Hussein, all of them, they have practices here at around Birmingham, and they can help the community. And I think that's mainly it, I guess. Yeah, so one thing I forgot, our next topic, I think, will be about grief and trauma. Still, the date will be determined yet. I think Dr. Ihtisham and Dr. Zahid, I think they will do a similar talk, just like what we did. So inshallah, we will post the date, and hopefully all will come, and hopefully it will be helpful as well. And yeah, so yeah, and now we open the floor for question, discussion, anything that you want to ask about. Yes, Allah Sana. That's a very good question. Yes, usually like.
That we actually today, the plan, yeah, thank you so much. Yeah, I think, yeah. So, yes, so dementia and neurocognitive disorder, it's a very big topic. So we intentionally skipped it so that we can talk and address about it. It's a big topic. Especially Dr. Saminauddin is here. She will know that a big percentage of our geriatric population, automatically Alzheimer's is so common, right, after age 65 especially. So inshallah, we definitely would like to address all we call it neurocognitive disorder in our term, which is dementia. There are a lot of different varieties of dementia and many ways to get the help. So if any particular question, I'll be happy to answer if anyone has.
Yeah. So I think basically 3 tips. So physical exercise, more social interaction, and solving a lot of puzzles like Sudoku can help. This is what evidence shows. So especially like a lot of people, especially if they have family history of dementia, they can help. So being socially active, physically active, and solving puzzles can help. It will help, and also like having diabetes, hypertension, because dementia there's a lot of causes for dementia. So one of the common causes are like having a stroke. So having a good lifestyle, like maintaining a good weight, control of type of dementia, which happens because of stroke. But the other type of dementia, like Alzheimer, I think those things can help, but it not necessarily prevent it. But it will reduce the risk. But we can, it reduces the risk. Yeah. Yes.
Question. So, I mean, using these, when you guys prescribe medicine, like they're effectively drugs, right? They ultimately save your mind. So, how do you sit there and like balance, taking these prescription drugs versus, a lot of people started using cannabis or natural type solutions out there?
So what's the question
My
is?
question is really like, how is this? How do you know if it's like if you're having actual mental disorder and then you're sitting there trying to treat it through like altering to save your mind? So how do you? Is that like even halal?
The good way, one way I explain my patients, what happens is when, especially young generation, when they are depressed or anxious, there is one easy way. Like some people, like most, I would say 70 to 80% will tell me that Dr. Chaudhary, I was actually trying to numb my feelings by self-medicating myself with alcohol or marijuana. This is the most common scenario that comes. So basically what is happening, there is an underlying mental health illness going on. So to hide that, to numb, they think that they're numbing their feelings, but they don't know what they're doing the disaster here. Because what cannabis do? Like over the counter, not over the counter, I'm talking about the Xanax type of benzodiazepines when people do street drugs, right? It's so common these days. Like methamphetamine, they're like doing ice and stuff like that, a lot of drugs. So what these drugs do? One class is stimulant, one class is suppressant. One is suppressing your brain to the point that you are like completely suppressing your neurons in the brain functioning. And another one is stimulants. It's making you completely hyper. It's many of them causing schizophrenia and a lot of psychotic problem, manic problem, a lot of issues, especially depression is even worse. So what we do with medication, what happens with mental health disorders? Let me explain you very simply, honestly. There is certainly a chemical imbalance in our brain. For example, depression and anxiety, what happens? There is a neurotransmitter called serotonin in our brain. So definitely that is reduced. And with the medication, what we do, the selective serotonin reuptake inhibitors, SSRIs, and these are very good medication that actually help balance the serotonin in your brain to fix the depression and anxiety and make the balance in your serotonin in your brain. There are a lot of other neurotransmitters. It will take me time to talk about it, but this is like a very simple approach. What happens with schizophrenia, for example? There is excessive dopamine in our brain. So when we put people on antipsychotic, what they do, this lowers the dopamine in their brain, okay? So this is like very simple way to explain. And we definitely see the huge results of it, of course. It's amazing. Alhamdulillah. Exactly. Yeah. It's a magic. They're like, I know, right? Like, this is the thing that I tell my husband, Dr. Hassan, he's here, my kids. I tell them this every blessing and prayer, honestly. I work so hard, this keeps me going. Because these people give us so much dua, trust me. Like, it tremendously helps to do, we don't even know. As Dr. Hassan already mentioned, that people think that it comes with a lot of side effect because years it has been said that, oh, the psychiatrist will give you medication, it will give you tons of side effect. Which medication doesn't give you side effect? Tell me about it. Even Tylenol, simple Tylenol, if you just read the side effect, you cannot take that, right? It causes liver issue, so every medication is a chemical. Definitely we are fixing one chemical imbalance with yet another chemical, that's true. I don't disagree with it, but it's all called benefit and risk ratio. And that's why we psychiatrists are here to titrate the dose of your medication that you need. Definitely, we don't put you on a big dose for a long time. We, when see that people are coming to a remission, we keep them on a very low dose, maintenance dose. For example, a lot of my patients are so much better. I just try them not to be on medication for a few months, even see how they do without it, only with therapy and counseling. So there are many different ways we have planned. Each patient is unique and different, and each patient's reaction to treatment is also, like reception to treatment is also different, I would say. There are a lot of, exactly. So every treatment is actually individualized that way too. Oh, you want to hear about bipolar? I didn't mention that. Yeah, thank you so much. I appreciate it. Yeah. Yes, sir. So here is the thing about bipolar, as I was just explaining you, right? So when I was talking about, this is like a normal happy medium of mood. So with depression, we see that people go downhill for a couple of weeks, and all those kind of depressive symptoms. When bipolar, these people will tell me, Dr. Chaudhary, I never have a happy medium. Either I'm here, or my mood is polar opposite to depression. Those people for 3 days to up to 7 days, they don't sleep, they are hyper-energetic, talkative, flight of ideas, shopping spree, racing thoughts. They don't sleep, they're talking the way with the pressured speech, and their mind, the way their mind is racing. Even you can tell, oh, this guy is probably hypomanic or manic. And then they crash again to depression. So they very hard for them to find a balance and have a happy medium. So this is like a very generalized term, the way of explaining bipolar. There are many different varieties of bipolar again, bipolar 1, bipolar 2. There is another term called cyclothymia, persistent mood disorder. So there are many different ways. It will take me another talk to talk about it, but in general, when the people do not find a balance in their mood, and either they are extreme end of depression or extreme end of hyper, that is more or less bipolar. But oftentimes bipolar is either underdiagnosed or overdiagnosed, and is overlapping with a lot of personality disorder. That's a big term we did not even mention today. A huge volume of our mental health people actually suffer from personality disorder, which is a big, huge term. Paranoid personality disorder, borderline personality disorder, schizoid personality disorder. Lot of different topic will come up in future. If you are interested, we'll be happy to address this on a topic base in future, inshallah. But thank you. Those are all very good questions.
I think there's question.
Yes.
That's a good question. I think one thing about depression, that you reach a state that you think this is the only way to, I think this is the only pathway, this is the only escape. This is like everything will be dark in their mind, and that's it. The only way I can just, get rid from all the suffering that I'm having is just to end my life. So that's why eventually, like, one of the things that we do, we keep the patients who have suicidal ideas and they want to act upon them in the hospital, give them medication, make sure that they don't have like suicidal ideas, and after they are, recover a bit, then we can, discharge them to the community or something else. But usually, this is what most, patients with, depression or when they reach suicide, they will have this kind of thoughts.
And just one last thing. Now, especially for when someone is coming, Dr. Uddin, with acute suicidal ideation, at that time, some of the SSRIs can even cause emergent suicidal ideation. We need to be very tricky here to treat when someone is actively suicidal. So what we do when someone is actually, there are a lot of ways. There's another big topic, a very important question this is. We inshallah will share in our website this one too. The suicidal hotline, who to call when you have that type of, when your depression gets to the point that someone of your family member is voicing something like that, where to call. So we will share the suicidal hotlines and all those numbers. So what they do, they bring those people to the mental health, whichever inpatient mental health unit we have, UAB, Brookwood, St. Vincent's, Grandview, yeah. These four, I know that they have we all have, I'm from Brookwood, and I work for UAB too, and VA, Princeton, yeah, and Shelby Baptist also. Zahid bhai, any other in patient mental health unit in the community. I think so far I addressed 5 or 6. We'll put that in our website. Yeah. It's- Mhm. Right. That's true. Yeah, that's unfortunately true. Yeah. Yeah, yes, please. And we are just talking about inpatient. When patient is actively suicidal, they need to be admitted in a hospital. So these are few inpatient hospitals.
I know, Assalamu alaikum again. So what I was trying to say is that, a lot of us are nowadays doing telemedicine. So those of us are here, maybe some of them don't have any issues, but of course, if you look 4 sides of you, you'll probably, she was saying that 25% of the people has mental illness. So if you just look right, left, behind, and forward, you'll probably, one of us has some mental illness, right? Well, so what, yeah, but what I wanted to offer something where we can, like, since we do telemedicine, so, and like from the phone, we do, what they call FaceTime and things like that. Even if you don't want to share our phone number, if you all have someone in our community that needs help, so we can have a central kind of a place where maybe my kid or somebody's kid is wanting some help. So if we know that, then we can communicate them in privately, they can do it from their home, and we are doing it from our home. So it's not that we have to go to our office, and they have to come to our office, so they will be privately. We can at least talk with them about what their needs are, and then from there on, we can do something. So that's one of the resources I think we can kind of, all the psychiatrists here, we can come up with a plan that can help our community kids, our adolescents, even adults that needs. You're talking about dementia. Actually, I work in a geriatric psychiatric unit, and Dr. Samina Uddin, she's a geriatric medicine. She has a fellowship. I don't have any fellowship, but I work with day in, day out with in a nursing home. I don't work in a nursing home, but a lot of the nursing home patients come to me, and in the rural areas, there's no neurologist. So I'm the one who kind of ends up diagnosing dementia. So I have a lot of experience in that field, so maybe we can help, inshallah, some people, those who have any questions or something like that. That's what I mean. Yeah, thank you. Sorry?
Everybody needs to see a psychiatrist once in their life.
Well, I guess, yes.
25%. If you are among the one of 25%.
I'll talk about that, but he has a question in the back, I think. Sorry?
So I was going to ask you, what are like the drug-free options out there for mental health?
Drug-free options are therapy, psychotherapy. Lots of different types of psychotherapies are there. So if you don't want to be on medication, some of the mental health disorders are really hard to treat, as I was talking about chemical imbalance, right? But if you, yeah.
So the question really is, like, I think you were, maybe it was the first presentation or whatever, but you were talking about how our minds are running like constantly. So we're getting away from the true kind of like sick patient. Just think about general mental health, right? Everyone's stressed like crazy now, right? So from that perspective, what are the options?
Lots of counseling and psychotherapy services are there. So those are the alternate options than medication.
There is some, like, I forgot the name, but I will share it with you guys, I think. Sorry.
Yeah. We will share all those things.
One thing, like, people, they don't, like, if you are fluent in English, there is a website, I think, called Self-Help. I think it's based in the UK. So it's basically like, you can use the techniques of, like, psychotherapy, for example, CBT, and you can try to work on it. For example, if you have like racing thoughts or running thoughts that you can't stop, there's a list of problems with all those definitions. You can read about them if you are interested, and it can help you to start or do some techniques that can help you, deal with those thoughts, like some mindfulness techniques, some relaxation techniques, and those are also are helpful. I will share the link of website. So if you just really, like, you feel that I'm not that sick, but I think I might have a problem. There is a problem that I think I need to deal with. I don't want to see a therapist. I think this will be a good start. Maybe at one point you'll notice, like, you know what, this has been helpful. I don't need to see a therapist, or I don't think I need. This is not helpful. I need to see someone. So yeah, I think this is something worth sharing as well. Yeah.
No, I think he wants to say something.
Is there a preventive steps a person can take to avoid depression? Or is there some kind of psychological evaluation a person can take random, like we do eye tests, we do all that stuff for the physical. Is there something for the mental?
Yes.
Number two question is a lot simpler than that. What's the difference between the psychiatrist help and the counselor help?
Okay. So.
There is a brother, inshallah, he will accept Islam, so inshallah ta'ala, I guess. How long will it take until we finish?
Yeah, it
I
depends
think
on
we'll
the
finish
audience
this
whenever they want. But
Sit in the back and we can talk to them, I guess.
Yeah.
I think we can talk.
okay. So answering your first question, there is no test like it tells you, like, you know, to help you to predict or mental illness or prevent. If I'm answering your question correctly, in addition to what we do for our physical health, like, you know, exercising, maintaining a good lifestyle, this is something that we can help as well. Spirituality is important, and I think Sheikh Tariq can tell you more about this, like dua also can help as well. And I think one of the things that, you know, like the social activity also, it can help as well. Gathering with people, talking to them also can help. Those are like simple things that I can advise doing, but I don't think there is something, you know, solid that tells you if you need to do this to prevent from depression. But at the end of the day, it doesn't mean that you are actually, you know, you don't have any risk of depression. You can do this to reduce the risk, but it doesn't mean that, you know, you won't have any.
The main thing actually what is, like, there are so many compounding factors for depression. If you have a, say for example, positive family history of depression, so you are very prone to develop depression, right? So that's one thing that's not in your control, but definitely what the slide I showed in the very beginning, I don't know if some of you remember, that physical, mental, emotional and spiritual well-being, taking care of exactly those things that Dr. Hassan also mentioned, is kind of a preventive. Definitely there are preventive gestures like mindfulness. This is what I tell all my patients daily. Go to YouTube. There are lots of 10 to 15 minutes videos on mindfulness. Just type mindfulness and meditation. There are really good mindfulness videos there. Practice them every day for 10 minutes. That's actually help you to focus your mind. And definitely prayers and spiritual journey helps. Thank you. Yes.
I kind of have a general question. So, like, if your parents don't believe in mental health, what are some approaches you could use to, like, get them to talk about it?
Very good question. She is asking, if your parents don't believe in mental health, what steps you gonna take to make them convinced that there is mental health problem exists, right? Yeah, it's a very good question actually. This is how.
I think there's many options. If they're around, they can approach and come and talk to us. We can help to explain a bit as well.
Now you can learn yourself. What you are learning today, that will be your learning tool. You share the resources. You show them the right evidence-based data. What is mental health issue actually? Is there so many people, like the expert panel is here to only talk about this. So tell them, you can enlighten your parents too. Like, this is what we all should do as a family actually. We enlighten each other.
You know the answer to this. You have to be your own advocate.
There you go, yeah.
You have to be your own advocate in every medical situation. I don't care what your medical problem is. You have to be your advocate. Nobody can tell you when it's been enough time at the therapist. Nobody can tell you it's been enough time at the chemotherapy place. Nobody can tell you when it's been enough time at the blood clinic. Nobody. You have to say, I don't feel well yet.
Yes.
I'm not ready to stop yet. I still need to be here. But you also have to make a choice to feel better.
Exactly.
You have to make a choice to be better. You have to be in that frame of mind and mindful about feeling better constantly.
Thank you. There's a very good, yeah.
So, like, what can parents do, like, to kind of detect if they have mental health issues? Like, what are some red flags they should watch out for? Like, parents.
From the No, parents understand kids having issue or kids understanding parents having issue? Okay, so the parents should, what parents should do to notice the red flags in kids, right? Yeah. So, for example, this is very easy way that I explain my patients. Like when a lot of patients come to me, the parents become patients because they can cope with this crisis of dealing with their adolescent kids. And so many people, and especially after pandemic, during pandemic, keeping them home. After pandemic, they are now like, it's kind of a rebound kind of thing happen. Now they can keep them home. So this is what it is. So the thing is, when the parents, this is what I tell them, like if you see that your kid, depression doesn't, exhibit in all kids the same way as I talked about. For kids, if someone is acting like very irritable, it's not acting right. Your child, you know your child the best, right? So when you see that your kid is not acting the right way for a couple of weeks or month, is it something there? You share with them, you listen to them. Sometimes listening to them with your ears and just, have an eye open to their gesture is a big help. Parents are the best help, I would say. We psychiatrists are down the road, but definitely all your education, all your help, all your health related issue, it has to start with the family. If the family bonding is like there, if you are close to your mother, try to educate each other. Something you learned today from this talk, you go share with your family. The same way the parents should do with the kids. And both should have that mutual understanding. So the red flags are these. If a child is not acting right, if a child is more irritable, if a child is not sleeping, if a child is not paying attention to their studies, if their grades are falling, if they are not paying attention, if they are not praying the way, the prayer, the namaz they used to do, suddenly they stop praying. Suddenly they are not reading books. Suddenly they are not coming to the family dinner. Suddenly they are not doing the family activities. There are lots of different ways to tell. So these are like not a book red flags. These are like real life red flags that I tell all my clients, all my parents who come to me. Yeah. Hope this answers some of your question. Thank you.
Myself, and I know this with a lot of people my age, we grow up thinking that for one reason or another, we think, because it's more so culture, but we think oh, Islam says don't talk about mental health, which is not true, right? It's more of a cultural thing.
Yes.
Yes. Oh, hi. So I was just wondering, I guess, what Islamically can we look at in the Quran or in Hadith, what is there specifically showing mental health, the Prophet doing with mental health, what is there that we can look at Islamically, Islamic evidence that shows this is what mental health is and how we can deal with it?
Actually, the questions that I had, may Allah reward you with these two questions, because to be honest, this is the dilemma that I have as an imam here, to deal with, especially with the community. Most of the community, especially with the old ages, the only thing they know that they need to go to the sheikh, right? When I tell them that you need to go to a doctor to see there is a mental health or not, they would look at me, they give me an eye. What are you talking about? It's a stigma, right? Right? Ya Sheikh, I think it's an evil eye. Ya Sheikh, I think it's a shaitan. I think it's a hasad. No, you need to go and see a doctor. There is, subhanAllah, the Prophet sallallahu alaihi wasallam, he mentioned in the hadith, there is no disease that Allah subhanahu wa ta'ala has created except that He also has created its a treatment. So you need to seek the treatment for this illness. From the Islamic perspective, actually, we need to know that this is from the second or the third generation of the Sahaba. After that, so for example, we have Abu Bakr al-Razi, we have al-Balkhi, the philosopher, the physician, they mentioned that. They have a lot of resources, right, about mental health. And if you notice what I exactly recited in Salat al-Isha, I meant to recite it from Surah Al-Anbiya to get exactly the problems that the prophets had. Prophets of Allah subhanahu wa ta'ala, they had that. The stress, the illness here and there. Ayub, Yunus, right? Zakaria, all the prophets.
Actually, Brother Tariq, in the Quran, Allah asked Prophet, "Oh Prophet, why are you so anxiety? Why are you killing yourself out of the anxiety?
فَلَعَلَّكَ بَاخِعٌ نَفْسَكَ in Surah Al-Kahf, yes.
Why are you killing yourself with anxiety?" So it is there. And actually
is a mandatory, actually. It's a mandatory. From the Islamic perspective, we have a lot of ayahs, we have a lot of ahadith. From the spiritual aspect, most of the mashayikh, they knows how to go with that, to talk about patience, to talk about sabr, to talk about the test, how can you navigate through these problems. Once you see, for example, why the Prophet's been mentioned, do you think just for me and you to hear it, to be amused by it? No, to know how exactly you can go through it. Why? Because all the prophets are human beings. They've been through us, through the problems that we have. So if you know how Prophet ﷺ, for example, Allah subhanahu wa ta'ala revealed for him, Alam nashrah laka sadrak, what exactly, why the reason that Allah subhanahu wa ta'ala sent for Rasulullah, Alam nashrah laka sadrak. We have a lot of resources, a lot of books, by the way, from the Islamic perspective. I can, inshallah ta'ala, share with you some of these books, inshallah ta'ala, that I read.
Yeah, I think brother there have a question. I think he has been raising his hand for a while, so let's. Well, yeah. So that's yeah. So that's a good question. So the thing is, like, so far there is no like solid reason. Like, for example, for depression, we can say it's only the serotonin, or we can say for schizophrenia it's only dopamine. The thing is, we know how the drug work. This is how, like what Dr. Shadow explained, that this is how the drug work, and we see a response. But it's much more complex than that. It's not like black and white. So you are talking about something called the black box warning, which says like people who are, I think, below 18 or something like that, they might have suicidal thoughts. This is something mentioned, but on the other hand, depression itself, like, it will lead to suicide much more than the medicine itself. So a lot of people relate to the medicine, but actually at the end of the day, like, those suicidal thoughts we see in the patient, it might like continue for a few weeks or few days, but sometimes it resolves. Sometimes if you change the medicine, there's a lot of options. And even the medications like Prozac, it doesn't act only in serotonin. There's a lot of ways that it acts, and there's a lot of options. So the way, like, the serotonin, dopamine, it's a simple way just to understand and to explain with the patient, but it's much more complex than that. So that's the thing. But eventually, the person who has depression and receive a medicine and develop suicidal ideas, eventually we need to give him medicine for depression. Like,
طيب إن شاء الله would like to thank Sister Dr. Jariya, Dr. Ahmed, may Allah reward you, may Allah bless you for your time, for your expertise, inshallah ta'ala. Inshallah, I'm going to come again, I guess. You know that we have A lot of questions. Inshallah. We have a brother Fraser, inshallah ta'ala. He will talk the Shahada right now. Come here, brother. Brother Fraser, he's a student from UAB, and he shared an email that he interested to learn about Islam. Dr. Nasim, he brought him to the masjid. Sister Maryam spoke to him. Sister Monica spoke to him. I spoke to him. So he's ready, inshallah ta'ala, to take the Shahada. طيب. Let's go with that, inshallah ta'ala. Are you ready? Ready. Okay. أشهد أن لا إله إلا الله وأشهد أن محمدا عبده ورسوله. I bear witness that there is no God but Allah, and I bear witness that Muhammad is his slave and messenger. Congratulations, Takbir. MashaAllah, Takbir. Congratulations, brother. MashaAllah. Alhamdulillah. Alhamdulillah. Welcome to the bigger family, to the Muslim family.